I've repeated it to myself over the years, the warriors take the arrows. And that was one of my colleagues and friends, mentors shared it with me. When we would go into a difficult situation, to ramp yourself up because you're going into the refiner's fire. And so for me during that time, like very unpopular, people didn't like me. If 50% of the people liked me on a given day, that was a good day. A colleague of mine, he was deploying a similar change in a hospital. As a joke, they bought him a bulletproof vest. Like when you're a change agent, you're only, like all you get for it is misunderstanding.
Jed Rudd, originally starting his career as an occupational therapist, is now the CTO of Tribal Health. He also runs a company called Mach, which focuses on streamlining healthcare operations. Jed, thanks so much for joining us.
Thank you for having me. I'm looking forward to this conversation.
So I think let's take it back to the start. Tell us, what got you into being an OT, what you loved about it, and then let's talk through the journey of you making the switch into now running this large organization.
Thank you. Yeah, for sure. Actually, I started out in my bachelor's degree as a theater kid, writing and producing my own plays. And I kind of saw that was not necessarily the lifestyle I wanted. And I was trying to figure out, like, what could I do career-wise that would let me still be creative, but then also be able to, come home at night and be with my family as opposed to being kind of a night shift person. And my father-in-law was an occupational therapist at the time, and we were always kind of brainstorming different things you could do with that career. And so I jumped in, and it blended this kind of creativity with science. And I see that as kind of actually a theme within these science-driven professions, that there are creative people that are drawn to them, and they express creativity through those kind of typically hard science professions. I think it's kind of interesting. But then right after kind of I started working with people, and I went to a rural community. And I loved that exposure because I got to try a lot of different things. So I was doing, inpatient and outpatient and home health and skilled nursing. And I got to do all the skills. So when you go rural as opposed to metro, you get to broaden your practice. Mm-hmm. But then I also immediately saw the commitment to being a great clinician. Because when you come out of school, you're kind of useless. You're just like, okay, what is everyone else doing? Hopefully I don't hurt anyone. And then you realize that the path to becoming a great clinician is one of rigor and study. And I was looking around at the leaders of my institution, and they couldn't find their desks, right? And it's like, why are the healthcare leaders so unprepared, and yet the clinicians are like masters? So if I put half as much time as I needed to put into the clinician journey to be a good clinician, if I put that towards the leadership journey, could I make a bigger difference there? I think so. And so, it just kind of pulled me into this vortex of opportunity, and jumped into healthcare leadership. And I'll stop there.
Yeah. Well, what I really want to hear about is, what is the journey from being an OT to you, over the span of, I think, 7 years, became the COO of Gila Regional?
Yeah.
Right. What did that look like?
It was wild. It was every year a new adventure, every year a new opportunity. And so it was just nonstop learning, which I loved. That was the easy part. It's like, okay, I love learning. I love building new systems and trying new things. But then I also got to deploy it in real time. It wasn't theoretical. I had to just like a clinician, I had to put it into practice and see if it worked. And it rarely worked. And then you go back and scratch your head and kind of retool it. So that was the hard part, was learning to adapt those practices that I would learn. But year by year, my journey with Gila was just new advancements, new opportunities. And unfortunately, the hospital continued to crater. And so there was a kind of a turning point when one year we posted an $11 million loss. The previous administration had decided that if their only solution was to let a bunch of people go. So they fired a bunch of people, and the community was in uproar. And the board was smart enough or stupid enough to give my mentor and colleague the opportunity to step in as CEO. And that kind of pulled me into the executive structure. And there we were, okay, cool. We've been talking about what we would do if we got this opportunity. We have all these, we would design it and kind of plan what we would do if we got the opportunity. And now we had an $11 million deficit to turn around. And we also committed to hiring everyone back. And so it was got real of okay, let's use best practices. Let's use leadership best practice, process best practice, technology best practice, and put it in a blender. A year later, we had turned it around. And then it was, suddenly we wanted to be great. It's okay, we're pretty good. Could we be the best small hospital in America. Let's do that. And it felt limitless and the potential was there. And that's when I also kind of assumed the first time this de facto CIO role. And I suddenly had to like deal with meaningful use and ICD-9 to ICD-10 translation, like this kind of nexus of MIPS and MACRA, all the different legislation stuff happened. And that was where I grew some IT chops that later like influenced Mach 1 integration and where we're headed with that.
Yeah. Oh, that's incredible to see the turnaround. Maybe talk to us about what do you see in world-class operations, right? What did you institute or what are the systems or processes you put in place to really drive that turnaround and then make sure that the business was set up in the future as well?
It's multifactorial. And like this adage famous from Bruce Lee, right? Adapt what is useful, discard what is useless, and add what is specifically your own. You have to do that. So there is no simple, follow the Green Bay Packers playbook and you'll win the Super Bowl. Right. None of that. It doesn't work. So if you try to adopt without adapting, you will fail. And that's what we keep saying. As everyone goes out, they learn the best practice, they try to do it, it doesn't work. So with us, we had retooled all these best practices. I mean, some of the standards, right? You got to have a consistent way of doing things. So you have to break everything down into its component parts, establish standards, and measure those standards. And then you have to have the uncomfortable conversation that leadership loves accountability for everybody, but autonomy for themselves. And so we rewrote that script. We said leaders will be the accountable ones. We lead by being accountable. So we kind of flipped the script. We joked about this meeting that we established. Every Friday at 4:30 was a leadership meeting. Of course, there was a small group of people that would actually come to that because it's wildly unpopular. Everyone wanted to go home early on a Friday. But it was that kind of commitment that it took of like really breaking down the hospital operation, looking at every single contract, every single supply expense, and ferreting out all the savings opportunities, and then looking at every single position and asking the hard questions. Do we need it? Can we possibly survive without it? And it's just like nickel and dime every there, and suddenly you have a turnaround.
And so, as we continue along your journey, you then took a role being the COO of United Indian Health Services, which is, I think I did a little bit of research on that, and I think it's an incredible organization. What translated, what didn't? Tell us about that transition.
Yeah. I had an opportunity to work with another rural hospital before then. But when I was with United Indian Health Services, it was my first time stepping outside of a hospital environment. So I had been living through COVID in the hospital environment, and that was like 24/7. We never stopped working. But then going into United Indian Health, it was like a really well-run, immaculate organization. Like one of the premier, I think, Indian Health service type organizations there. They're technically they're run by their communities. So they're not federal, but just really standout organization. And we had, the opportunity to actually build programs that made money, which is shocking as a healthcare leader. Oh. Oftentimes you're trying to put things together to like stop the bleeding somewhere, right? It's like, I'm losing money over here. So if I can just build this program to offset the loss. When you're in a rural hospital, rarely, I never understood why people hated hospitals so much because we were always like scrappy. But I get that like maybe larger institutions have lots of money. We never did. And so with United Indian, it felt like we had like good reimbursements for our services so we could be really innovative. And so that period was like really unleashing a lot of innovation, coming out of the COVID curve and starting to open up services again. And it really made me appreciate the creativity of those communities, the ways that you can embrace traditional approaches within healthcare systems. We had spiritual healers, sweat lodge, all these cool stuff that you could blend into the Western approach to medicine. And to me, that was, I enjoyed that time. And the people were just, it's the coolest place on earth. I mean, it's paradise up there. So if you ever get a chance to visit, Humboldt County, I can't speak highly.
Where's that out of?
Just, that's like 5 hours north of here, 6 hours north.
Oh, really? Okay.
Further north than you think California goes. It just keeps going.
Yeah, I've only gone up a couple hours, so we have to go and check that out.
Yeah, it's like you enter Rivendell.
Yeah.
The Rings.
With all the Lord of the Ring references that we have here.
Yeah,
this room is Took. Did you see that's the name of this room?
Oh, really?
Yeah.
Dude, that's a cool. I approve of that message. But seriously, when you go there, like it really does feel like there's waterfalls and giant trees. You feel like you're going to see a hobbit pop out of some kind of weird tree.
Well,
so they shot like what? Anyways, we can keep going. put that out.
So maybe talk to us about, when you were a clinician and everything you learn as a clinician, how does that today influence your decision making at Tribal Health? So maybe tell the viewers a little bit about what Tribal Health does and then how it's influenced your decision making.
Absolutely, and kind of weave the clinician journey into it. So Tribal Health, we're a staffing and practice management firm. Our goal is to really approach Indigenous care differently. A lot of staffing firms that service these communities, their standards for the clinician they send out isn't the highest. And our goal is to flip that script and to do board certified, highly qualified, mission driven clinicians, not mercenaries. And that takes more time, more energy, more support to achieve that end goal. But that's the ultimate goal of Tribal Health, is to service these communities at a high level. And from the clinician perspective, how do we design systems of care that matter to the clinician? Like, we have to, obviously, from an operational perspective, build systems and processes, and those oftentimes aren't felt directly by the clinician, but how do we always keep the clinician first in mind? And what matters to us from an administrative perspective is rarely what matters to the actual provider delivering care. And so kind of having that humble pie every day of like, how do we break this down further? How do we make it actually work, thinking clinically? Like that book I read on staffing firm best practices probably isn't going to work. How do we retool it and redesign it? As we're working through technology, how do we retool and redesign that so that they're the priority, not me and what I think is cool?
Yeah, absolutely. No, I think it's a unique way to put it. Maybe talk to us about some of the work you've done in the rural and remote communities. I know you do a lot of work there. And maybe even tell us about one of your most memorable stories that you can share for the viewers.
Sure. At Tribal, there's just so many cool stories. It's not a joke. Like, Tribal is not a marketing ploy. It's real. It's a very real commitment. And sometimes it's really hard to serve. Like, it's not glossy. It's like when you kind of summarize it, it's like, oh yeah, we're going to go do this. It's an adventure, da-da-da. There's a sales pitch to it, right? Yeah. But at the end of the day, it's hard. So a couple of examples, we were helping a hospital open up in northern Arizona. And it turns out that they ran into a bunch of issues with water. It's Arizona, shocker. And they couldn't open up the hospital or the hospital housing. So we had to scramble, find temporary housing. We put everyone up in hotels. And then the team had to go and build the furniture. Like, we drove up and then we're building furniture right side by side, trying to get everyone ready and situated. Like, when we go and serve these communities, sometimes there's nothing there. So you're establishing the logistics of how do you actually get people in and out consistently. So it's kind of that, eating pizza on the floor at midnight after you've had a hard day of work kind of vibe. And a similar story, we had a hospital get snowed in, like just drifts. You couldn't even go home. So we had people stuck there. And, there was care couldn't get in or out. There was dialysis patients that needed care. There was a baby being born. So people were caring for the baby. They're like spotting each other for shifts, sleeping in the break room. Food's running low. Our co-founder and executive chairman is a pilot. So he's flying up with food. Like, this is real, right? It's like those aren't the stories we post. But that's kind of like the grit and texture of Tribal. Is like, actually, how does it work? How do you get people to a very remote area, hopefully support them enough that they'll want to stay, give them the tools and technology where it's easy as opposed to difficult? Because the journey just to get there, I mean, those are some kind of cool stories from like getting there, right? But there's this whole process from first conversation to getting there. And it's unfortunately like just as hard. Yep. Or as inspiringly just as hard.
Oh, that's inspiring for me to listen to. And I think that's an incredible. Maybe talk to us about why do you do it, right? Because I think the why behind what you do is so important in some of the conversations that we've had. I would love to hear about that from you.
Yeah, you want to do work that matters, right? And I think when I first stepped clinically into a rural community, you were not theoretically, like, you were really treating your community. Like, if you were my patient, I'd probably see you that night at the grocery store, and I'd see you again. And if it was your kid, my kid's probably gonna be friends with your kid, and we're gonna go on play dates together. Like, it wasn't this kind of remote experience. We were literally caring for our friends and neighbors, and we were also the only game in town. And so it's like, if this care system fails, or if we have bad care, there's no one else here. We can't ship you off to the next hospital easily. So that, to me, like, there's a certain kind of community that is fostered. And so that, to me, is like, can we create community experience in the workplace where we're doing work that makes a meaningful difference on the planet, serves and makes things a little bit better, and that gives us a sense of connection and purpose? Because at the end of the day, we spend a lot of time at work, and can the workplace be a transformative experience? And this is where sometimes, as my current role as a CTO, or when I'm a COO, you get kind of like pegged as you're super into data or numbers or like whatever, like you're this kind of math nerd, and I'm not. What I love about these systems and processes to make them better is that it allows us to potentially connect more with greater awareness in the moment, right? If I'm not worried about this drama of terrible systems and processes and people and technology that sucks, like, I'm able to come at you with greater like heart and show up, as opposed to being frustrated by, I can't clock into my shift today. This freaking thing doesn't work, right?
Yeah.
So to me, like, that's where we cut through the technical and get to the heart of the matter. So if I can like spend time having cool conversations, this lights me up. And I get to have these kind of conversations with the people I work with while we're trying to design a new process or a new technology solution. Then we just took it from this level to that level. And we approached the same end, right?
Yeah. And on that point, it's interesting you bring that up. What has been some of the most innovative technology or tools that you've worked with, or you guys are in the process of implementing? I would love to hear about that. Of course, we're in the Bay Area right now, and
yeah,
I think we just see new technology coming up left and right. The question though is, how much of it can you actually deploy at scale, right? And for the use cases that you just spoke about in this rural communities, I'd love to hear about what you guys have focused on.
Absolutely. What we saw with Tribal, we're kind of trying to approach the staffing game differently. With most of us come from healthcare as opposed to salespeople. A lot of staffing industry people actually come from sales or business development, not from the healthcare lens. And when we started to design our, mission of what we're trying to accomplish, the tools were not built from the ground up with that in mind. I think the foundation of what you build from has a direct impact on the outcome of the products. And so as we continue to look for these kind of really basic solutions to our problems, like the tools, they were either like built for staffing or built for hospitals. And we were a little bit of both. We wanted transparency and team-based ownership. We wanted collaboration. And if you're a staffing firm, that can be like not good. Like, you want to keep everyone, no one should know who's working with anyone else. And if you're a hospital firm, those tools are like way overkill for our use case and really expensive. So we started with one solution, which was scheduling and timekeeping. We couldn't find a solution that integrated with our tools that provided a good user experience with more features. So we set about building that. And as we were building that scheduling and timekeeping platform, it became clear to me that there's this whole layer of technology solutions lacking in the market. And I would classify them as like client and clinician centered solutions that connect to these really robust systems of your CRM, your ATS, your EHR, and your HRIS systems. But like, those are built for the back-end people. And whenever they put on a tool that does the basic thing that the provider wants them to do, they fail miserably. And so can we design a system that like gives them a better experience and meets the need? And what we're finding is that A, we can, and B, we're able to do more features at a better cost. And we're actually able to leverage AI in ways that I think make life better for the clinician. And it's real AI, not the fake AI.
Yeah, on that point, what have been some of the most surprising or just, I'd say like jaw-dropping use cases of AI that that your clinicians can use today, or maybe they're already using them today?
These aren't jaw-dropping. These are like so basic. That's what actually I had a really humbling experience recently. I was going through a round of interviews with people, end users, trying to get, as we're doing our product roadmap, like, how do we design something that meets your needs? I have my visions of like this cool like algorithmic approach that we're going to do that's going to like do the schedule in a flash and everyone's going to be happy. And none of them cared about that. They were like, no, I want the thing to work consistently in all these different clocking in and clocking out in various scenarios. There were like 6 more use cases that we needed to problem solve for first. Schedule access to schedule basic stuff first. And then with our onboarding platform, no one has done this basic move. Okay. So a doctor has like 600 forms that they have to submit. And those forms have to fill out another 100. You're going to get bored real quick. Your eyes gloss over with these topics because that's why no one's doing this, by the way. It's because everyone's like, oh, it's so boring and complicated. But if you can find passion in the nuance and the detail, then it's actually kind of exciting. And that's our strategic edge, is like we're making the boring beautiful in Mach 1 integration. Like we're going to take that kind of these areas that no one wants to touch. So on the onboarding piece, you got all these documents that a provider has to submit 800 times. They have to fill out 1 billion forms, and all the information's in those documents. No one's built a tool that parses all the documents and puts them into the forms for them. One click, that's it. Simple vision, right? There's like, I don't even know how many platforms are that are doing this solution. They're glorified OneDrives. So they take the documents and do nothing with them. Yeah. And the provider ends up, or a credentialing person, ends up typing in these forms. So that's our release we're doing in July, is the onboarding product. So using AI to parse, batch, fill. So hopefully 1 click, that's it, or two steps, and then they're done.
Yeah.
And that would revolutionize, because you're talking about some providers 12, 18 months waiting to get in. 6 months is usually like an average. I mean, this is horrendous wait times. And so you have these communities with high levels of need, doctors that want to go there, and then they are forced to wait.
They're blocked. Yeah.
So they're going to, of course, find another job, or they're going to be really committed, and then they survive that gauntlet. But then they go out into these communities where it's actually even more challenging. So how can we make that smoother, easier, better? That's our vision of these products. Work in a way that meets their needs, leverages technology in a real way, not just a fake marketing.
Makes sense. We see when we deploy technology, it's that last 5 or 10% of really getting it right for the specific use case. It is where, certain folks can differentiate themselves, because look, it could work out of the box. It may not work for your use case, right? It may work for use case A, B, and C down the road, but if it doesn't work for your use case, it doesn't matter.
Yes.
Right. And I think that's when you say about, when you just mentioned that these are like these glorified OneDrives, I think it's my guess, and we'd love to hear from you, is, they'll have a solution, but it won't be customized to the needs of what you need day in and day out.
Yes. It's customized for very particular, it works great for a large hospital system.
Right.
It doesn't work for the scrappy startup. Or, I remember when I was first starting out, like I couldn't get Epic to talk to me. The famous EMR, they wouldn't even talk to a small hospital. Now they've integrated vertically and got a whole bunch of solutions. But I would want a company, Mach 1, that would talk to the small scrappy startup and work for both. Work for a larger institution, work for a smaller institution. So the use case, there is a lot of opportunity to make it more niche, more customizable. And that's why I see like lots of collaboration between different products, different approaches, because we're all trying to solve the same problem, and there's a lot of nuance to each of those solutions.
Yeah. So talk to us about Mach 1, right? You started this company a year ago. What was the mission? What are you the most proud of? And where is it going?
Yeah. Well, Mach 1 started as a skunkworks project. So, John, the founder and executive chairman of Tribal, pulled me aside, said these technology solutions aren't working. I think we should spin up a skunkworks effort to try and innovate and see where that goes. And that's where, we took on that challenge of scheduling and timekeeping. And as we started to build it and see what we could do, and everyone told us we could not do it. When I talked to all the US-based people, they were like, no, don't do this. B, it's not possible. C, go back because you're going to hate this. And, in 4 months we were live with 400 users. And it wasn't perfect, but we continued to innovate, and we had more features than our existing product within 6 months. And now we're advancing even beyond that in year 2. So, and then of course we have our onboarding product that's being built and piloted and tested right now. So our goal is to really offer that end user client experience, streamline the healthcare operations of typically a healthcare staffing or practice management firm, but could be broader than that, and really start to make a difference where these nooks and crannies that no one else is focused on, or if they are, they're just not innovating. Like I don't see a lot of solutions out there that are pushing the boundaries of what a scheduling platform or an onboarding platform or invoicing or whatever. They're all kind of focused on the sexier stuff. If they can create an AI agent to talk to someone and vet them, get them in the pipeline, that sounds cooler than let's build, an onboarding platform that leverages AI to do this kind of nerdy stuff.
Yeah. And it's interesting you say that, specifically because when you think about the customers that you're working with, to your point, right, it's just getting that form to fill out or getting data to go from one place to another place or some transformation of the data. It's not like you mentioned, hey, this agent that may talk on the phone. One thing I'd be interested in is how do you iterate with your customers? Because I know that Tribal Health is likely a customer of Mach 1.
Yeah, they're a beta customer.
Customer.
Yeah.
Talk to us about what that iteration process looks like as you kind of go out and build product.
Yeah, it's listening, right? It's constantly looking at what the bugs are, like what are people constantly frustrated by? And then talking to a lot of it comes back to the admin. If there's an administrative person dealing with a problem via email or text, what is that problem? How can we solve it technologically? So for example, we service remote communities that sometimes have underdeveloped administrative processes, and they might be fearful of technology. So they say, don't use your fancy new app, right? Use our paper. Okay, cool. Our commitment is to serve these communities. How can we integrate? So we're deploying this week a paper timesheet based feature where we take a picture of a timesheet. AI, of course, is extrapolating all the data and pushing it into our system. Before it was somebody on backend taking a stack of timesheets and entering them. So again, using that lens of leveraging technology to solve a problem that serves a very unique niche, kind of disappearing use case, but one that meets the mission of one of our beta customer.
Yeah.
How can we do that?
And on the other end, how do you get them comfortable with the new technologies that are coming out, right? Because you look at a voice-based agent caller, for example, that can take full ambient conversations, right? That's, call it, multiple orders of innovation that need to be deployed at the same time. What have those conversations been like with the folks you talk to?
I think people are open to it. They're curious. I think healthcare is fairly resistant to change, unfortunately.
Right.
So I think it's just laying the foundations and then highlighting where AI is currently being used, how it's being used in ways that aren't threatening. And so for me, like showing them that, like, oh yeah, remember how we did that paper timesheet solution? That's actually AI. Here's how it works. And so kind of I think about those days of the meaningful use era. Are you familiar with that at all?
Yes, somewhat.
Somewhat?
Yeah.
Because I'm not going to go into great detail, but like we were way behind the curve when I inherited that initiative. And I had to dig into like the legislation in terms of like where it was going, and what was being proposed. And I gained an appreciation for what their thought process was. But their mind was not about serving the end user at all. The foundation was a little shaky, right? They were kind of trying to capture all the data and so supposedly improve quality, but it just made life harder for everyone else. And so I don't want to, like, I just want to highlight that they had good intent, but the intent, I hope, provided the foundation now that we're leveraging, right? If we wouldn't have done CPOE at that time, could we do what you guys are doing?
Sure.
Right, with your solutions?
Sure.
Maybe not. And so similarly, as we build these foundational platforms, as we start to integrate their paper timesheets into our system, does that make them more comfortable with the next step and the next step? I think so.
Okay. And then, I think you mentioned this mantra of warriors take the arrows. What does that mean? Talk to us about that. I thought that was pretty interesting.
Oh yeah, we were jamming about kind of leadership philosophy, and a mantra that I've repeated to myself over the years: the warriors take the arrows. And that was one of my colleagues and friends, mentors, shared it with me. When we would go into a difficult situation where rarely were we going to be celebrated at the end of the day. If you're out fighting the good fight, who are they going to aim the arrows at? You. And if you're a great warrior, right, you better be chock full of arrows by the time the battle's over, or you went in the middle of it, right? Get in the middle of that melee, right? Kind of take that attitude of like, how many scars can I get, to ramp yourself up, because you're going into the refiner's fire. And so for me during that time, like very unpopular, it kind of people didn't like me. If 50% of the people liked me on a given day, that was a good day. A colleague of mine, he was deploying a similar change in a hospital. As a joke, they bought him a bulletproof vest. Like when you're a change agent, you're only like all you get for it is misunderstanding. So, you know, how do you take that, which can be really difficult, right? Like you come home to your kids and you're like, my kids like me. So, but no one at work does, right? So you have to kind of like figure out a way to approach that where it builds yourself up because you know you're trying to do the right thing. So that's, you know, how can we embrace the challenge?
Yeah.
How can we approach life where we want more arrows? Like, am I living life deeply enough, authentically enough that I got a few more scars to tell? There's that famous quote, right, from Hunter Thompson. You know, I want to finish life coming in broadside. You know, flames and smoke. That's a life well lived.
Yeah.
That's a warrior taking the arrows.
Yeah.
Right. You got some scars to show for it.
I love that. Do you have any stories to tell? I mean, I'm sure you have hundreds. Any ones that you'd be willing to share where you or someone on your team really had to take the arrows?
This is a silly example, but I was overseeing a wellness center, and we were deploying new programs, and they wanted the pool to be changed from bromine to chlorine, and I would get hate mail.
Wow.
From members. They wrote me Jed, you dirty dog. And I kept that note because I thought it was so funny. Like, someone's that mad about the chemicals in the pool. That's like the smallest of origin, like the smallest example, right? But it was like magnify that times a million when you're standing in front of a group of physicians, right? And I was trying to convince them to leverage electronic. We were trying to show that if you talked, it was quicker than if you typed. So we did like a little demo, right? And we had someone who was doing the talking and then someone was typing. And we just showed the time difference. And they were done in 4 seconds. This person was still doing it. And still they would not adopt it. You know, just like those kind of weird experiences where you're trying to help, but all they do is see you as this villain that's trying to make their lives harder.
That's really interesting. One of the values that we have a bunch of values we look at the company we have here. My favorite ones and kind of plays into the warriors take the arrows are our number one value is the day doesn't end until the customer's happy. And the reason I love that is it really makes sure that you are working in service for who matters, right? For in our case, our providers or physicians or nurses or MAs or whatever the case is.
Yes.
So as a result, there's a lot of arrows you have to take to make sure that happens. And then the other one is extreme ownership, which is Jocko, right? I love his podcast. I read his book as well, but yeah, it just talks about, hey, if you have a process that you own or a metric that you own, you take full responsibility of it, no matter what. And that reminded me a lot of the warriors take the arrows and the mix of those two. And we talk about them every single week. And it really resonates with me when you say that.
I want to I love that you brought that up.
Yeah.
Love both of those. And to me, that's where values start to drive culture, right? Sometimes values are pretty words on the wall. How can you make it as visceral and meaningful where it becomes the weekly conversation? I think Jocko's, I like his second book a little bit better. I'm not sure if it's his second, but it's the Extreme Ownership sequel, The Dichotomy of Leadership. Have you read that?
Just the first one.
Okay.
Just the first one.
Highly recommend it, just because it starts to tease out the nuances of sometimes you're required to do the opposite things at the same time. And I think that's really like a fundamental, like, how do we deliver high-end customer service efficiently, right? You're kind of like always dealing with these two competing forces, and how do you express that? So you're trying to live your value, but there's like a nuance to it.
Well, we think of it as, you know, we're a hyper-growth company, but sometimes you do things that don't scale. So you learn about the customer, you learn about the process, you learn about what you have to do. Sometimes you'll do it really manually the first couple of times to ensure that you understand it, and then you can scale it, right? So it's almost like you walk before you can run, right? And so absolutely. Sometimes I can totally see how it's at odds. We'll have to check the second book out.
I recommend it.
He had an awesome TED talk as well on extreme ownership, and so we just loved we just loved that as a value, and we think about it every single week here.
And I would say that was like when you say, like, Jed, what was part of what you guys did to help turn that hospital around, that story? It was aversion. Like, it was extreme ownership before extreme ownership. How do you show up on a Saturday? How do you show up on a Sunday? What does that look like practically, not just like theoretically of like, I empower my team. Yeah. It's like, no, how do I show up on Saturday alongside my team when stuff hits the fan? What can I do?
Yeah. Well, that's where your actions speak the loudest, right?
I hope so.
The one of the final questions I have is, what are you the most excited about in the next chapter of health tech and just a lot of the innovation you're seeing? What gets you out of bed and you're like, look, I really want to build towards that. I really want to adopt that.
I think, the most exciting thing is that a lot of the potential that I saw when I first started the healthcare technology journey is starting to be possible. Like, the ideas of making life better for the clinician. And the stuff you guys are doing is directly related to that. And that's, to me, inspiring. So how can we contribute to that? What's our part in starting to break down the barriers of technology to leverage it in a way that actually services the people who service those in need to make their lives easier, and to have that be more than just a marketing ploy, like where it starts to be like in healthcare, it's real. I met you. The thing didn't work. How do I now innovate that thing to make it work for you? So to me, I get really inspired by that. I'm inspired by the age of AI. There's all this kind of fear talk around AI. I'm very optimistic about where we're headed, where it's taking us. So Skynet, maybe I just drank the poison early or something, but I see Skynet as a great help for us. And so if it's okay if I kind of go into that a little bit, because I have to go back to my optimism. I feel like it's rooted into the time before the internet. And like when you connected with someone, it was like this. It was like over campfires or like getting together and doing things, right? There wasn't any way to have a social experience outside of being physically present. And I remember very vividly the dawn of social media. And it was exciting, right? Like, I was in grad school at the time and I could reconnect with high school friends. And it felt kind of like, oh yeah, this is cool, right? And then very quickly, we all saw that start to drift into fake land, where it was like all this performative stuff that was like this weird social construct, right? That was ultimately fake. And I think there's a disillusionment there. Social media was supposed to socially connect us, and it socially pulled us apart. I see AI where everything can be, duplicated, your voice, your likeness, everything, right? It brings in the question of what is real. And instead of that being disillusioning, I see it being connecting. Because now I know the only thing that can be real is when it's this. It's pulling us into human connectedness again. Because I don't think we can always trust the feeds or whatever we're getting, right? It's like we have to learn to leverage technology as a tool and then leverage each other for where our genius lies. And so I see a lot of that potential clinically, right? It's going to put the clinician into their genius of being able to provide care for patients and not have to worry about all the documentation and billing and all that other stuff. And it makes our lives as administrators and leaders easier because we're connecting, we're creating systems of connection as opposed to dealing with these kind of minutiae. So to me, there's an unlocking of connectedness that lies within the age of AI. So as we continue to leverage it and optimize it with the true end user in mind, I'm very optimistic. So to me, how can I contribute in my small way? That's what gets me jazzed.
Oh, I love that. And that's what we think about. We wake up and think about every single day is how do we deploy this responsibly? How do we deploy it at scale? How do we deploy things that people will actually use? Right.
Yes.
And that work for their use cases and their workflows, right? Because each person's a little bit different. Any parting or final thoughts?
How can we make a difference? Like it's when we talk about scale and we talk about service, how can we reach those communities that get overlooked, right? That they're not like a cool target market that everyone's going for. How do we design solutions for them? To me, that's a really interesting question that as innovators, we should be thinking about too, not to just think about the metros and the big populations. What about the smaller communities that are a little more difficult, a little more nuanced? I would just encourage any innovator out there to think, how can I solve problems for them so that we start to collectively raise, not just if I move to a big city, my life's going to be easier and better. How can we focus on everyone?
Awesome. Well, thanks for the time.
Oh, thank you. It's been a blast.